Welcome to the deep dive. Today, we're really getting under the skin of a particular issue in cats' Notoedric mange. You might have heard it called feline scabies or even head mange.
That's right.
We've looked through some detailed sources on this, and, well, our goal is to break down what it is, how it gets around, what you should look out for, and, importantly, what can be done. Give you the essentials.
And, the thing that really jumps out is that it's not just a cat problem. These mites, they can actually cause temporary itching in people, too. Probably pretty unpleasant, I'd imagine.
Right. Definitely makes you think, yeah. So what kind of information are we working with today? What are the sources telling us?
We've got a pretty thorough overview. It covers the basics of the condition, who gets it, the signs, causes, how vets diagnose it, treatment, and even how to try and prevent it.
Okay, great. So let's dive in. What actually is notoedric mange? What makes it different from, say, other skin problems cats might get?
Well, fundamentally, it's a skin disease in cats, and it's not seasonal. It's caused by a specific mite, Notoedres cati.
Huh.
It's closely related to the dog scabies mite.
Okay.
And what these mites do is they burrow into the very top layer of the skin, sort of between the hair follicles, and that activity, that burrowing, is what causes this really, really intense itch.
Intense? It just sounds awful. And you said not seasonal.
Exactly. Unlike fleas, maybe, which can be worse in warm weather, this mite needs a host, so it's happy year-round.
Okay, so year-round misery, potentially. Who tends to get this? Is it certain cats?
Pretty much any domestic cat. Age, sex, breed doesn't seem to matter much. They're all susceptible. And like we mentioned, it's primarily cats, but Notoedres cati isn't super picky. It can sometimes affect other animals too. Dogs, raccoons, rabbits, even cheetahs.
Oh, yeah.
And yes, humans, we can get what's called transient pruritic.
Transient pruritus, meaning?
Basically, temporary itching.
Yeah.
If you handle an infected cat, you might get itchy for a bit, but the mites can't really live or reproduce on us long term.
Got it. Temporary, but still not ideal. You also said if one cat gets it, the others probably will too. How does it spread so easily?
Yeah, it's highly contagious between cats. It spreads mainly through direct physical contact.
Ah.
These mites, they don't survive very long off the cap, so they need that close contact, like cats grooming each other, sleeping curled up together, that kind of thing.
So direct contact is the key. All right, let's talk signs. How would someone know if their cat might have this? What are the first clues?
The number one sign is intense itching, really intense. And again, it's not linked to a particular season.
Right.
It might start off kind of mild after they're exposed, but then it usually ramps up and gets quite severe over, say, 3 to 6 weeks.
Okay, 3 to 6 weeks. Why the delay?
Well, that incubation period, that time lag, might actually be linked to the cat's immune system kicking in and producing antibodies against the mites. It's sort of a developing allergic reaction to them.
Interesting. So the itching is the immune response.
Largely, yes. Which is also why, interestingly, some cats might not get super itchy. Maybe they just don't mount that strong antibody response, but most do.
So intense itching is the big one. What about visible signs? What would you actually see on the cat's skin?
You'd usually start to see small raised bumps, we call them papules, and some crusting. And typically, this starts on the edges of the ears, the pinnae. That's a very common starting point.
On the ears first.
Okay, and from the ears, it tends to spread, often to the eyelids, the face, the neck, which is why it sometimes gets called head mange.
Ah, head mange. Okay, that makes sense given the pattern. Does it stop there or can it spread further?
Oh, it can definitely spread further. It often moves to the legs and feet, probably because of how cats sleep, curled up, transferring the mites around.
Right.
And you might also see it on the back end, around the anus, the perineum. And because they're so icky, they scratch like crazy.
Yeah, I bet.
That scratching causes self-trauma, breaks in the skin, and then you often get secondary bacterial infections setting in, which just adds another layer of problems.
Oh, poor things. So what happens if it just goes untreated, if no one figures it out?
Well, the skin itself starts to change. It can get really thick, kind of leathery. The technical term is lichenified. And it gets covered in these thick, grayish-yellow crusts. They can be pretty stuck on.
Wow, that sounds severe.
It can be. In bad chronic cases, you can see widespread hair loss alopecia. And these lesions can eventually cover large areas of the cat's body.
So it can become a whole body issue.
Absolutely. And another interesting point, unlike scabies in dogs, where finding mites can sometimes be tricky, cats with Notoedric mange usually have a lot of mites. They're often crawling with them, relatively speaking.
So easier to find, maybe.
Generally, yes. You might also feel swollen lymph nodes near the affected areas. That's peripheral lymphadenopathy. It's just a sign the immune system is fighting hard. And in really severe untreated cases, the cat can become quite weak and debilitated overall.
Definitely sounds like something you want to catch and treat. What actually puts a cat at higher risk of getting this in the first place?
The biggest risk factor, overwhelmingly, is just being in close contact with another cat that has it.
Yeah.
Simple as that.
Okay, direct contact again. So if an owner thinks, maybe my cat has this, what's the diagnostic process? How does a vet confirm it? Are there other things that look similar?
Oh, definitely. Ruling out other conditions is a big part of it because lots of things cause itching and skin lesions in cats.
Like what?
Well, you've got allergies, environmental ones like atopy or food allergies, bacterial skin infections, fungal infections like ringworm.
Ringworm, right.
Then there are other mites, Demodex mites, Shilletiella, which some people call walking dandruff, Otodex, which are ear mites, even Trombicula, chiggers, and then some less common autoimmune skin diseases like pemphigus foliaceus can sometimes look similar too.
Wow, okay. So quite a few possibilities. How do they zero in on Notoedres specifically?
The gold standard really is the superficial skin scraping. The vet scrapes a small area of affected skin, usually with a scalpel blade, to collect surface debris and mites.
Okay.
And as I mentioned, because the mite numbers are often quite high in cats, they're usually relatively easy to find when you look at that scraping under a microscope.
And can they tell it's this specific mite?
Yes, the Notoedres Cati mite has some distinct features. It's smaller than the dog scabies mite, for one. Its anus is on its back, dorsally located, and it has this really unique pattern on its back, kind of concentric fingerprint-like ridges or striae.
Like a tiny fingerprint.
Exactly, like its own little ID. Plus, only its front two pairs of legs stick out past his body outline. So yeah, they can identify it pretty confidently under the microscope.
Fascinating. Are there other tests, like blood tests?
Currently, there aren't readily available blood tests, like ELISA tests, to detect antibodies for routine diagnosis. So that skin scraping is really the key diagnostic step.
Got it. Skin scraping it is. So let's say the vet finds the mites, confirms the diagnosis. What's the treatment plan look like?
Treatment is definitely possible and usually effective. If dips are used, these are medicated solutions applied all over. It's absolutely critical that the entire cat is treated. Face, ears, everything.
Why is that so important?
Because if you miss spots, especially around the head and ears where it often starts, the mites hiding out there can just cause a reinfestation. You haven't actually eliminated them all.
Makes sense. Total coverage.
Exactly.
Yeah.
And crucially, you have to treat all cats that have been in contact with the infected cat. Even if they look fine, they could be carrying mites. If you don't treat them all, they'll just keep passing it back and forth.
Right, the whole group needs treatment. Is it usually successful if you do all that?
Yes. Generally, the response is very good if all the in-contact animals are treated properly and at the same time.
Okay. What about, like, cleaning the house, bedding and stuff?
It can be helpful, especially if the cat had a really heavy infestation. The mites don't live long off the host, maybe a few days at most, under ideal conditions. But a thorough cleaning of bedding, grooming tools, favorite sleeping spots, it certainly doesn't hurt as an extra precaution.
And what if the cat's skin is already infected from scratching?
Good point. If there are secondary bacterial infections, which is pretty common, then antibiotics will be needed as well to clear those up alongside the mite treatment.
Okay, so it can be a couple layers of treatment. What specific medications are used against the mites themselves?
There are several effective options. Lime sulfur dips are a classic one, usually a 2–3% solution, applied weekly for maybe 6 to 8 weeks.
Lime sulfur. Does it smell?
Oh, yeah. It has a pretty strong sulfur smell like rotten eggs, and it can temporarily stain light-colored fur or even surfaces kind of yellowish. So you have to be prepared for that. Clipping long fur first can help the dip penetrate better.
Okay, smelly but effective. What else?
Ivermectin injections are another common choice. Given under the skin, usually every 2 weeks for maybe 2 or 3 treatments. The dose is carefully calculated, of course.
Right.
Amatraz rinses can also be used, maybe weekly for at least 3 times. But you have to watch for potential sedation in cats with amatraz. Dormectin is another injectable option, sometimes given just once.
Are there any spot-on treatments, like the flea and tick stuff?
Yes, there are. Silimectin, which is in some popular spot-on products, can be effective when used off-label for Notoedric mange, typically applied every 2 weeks for 3 doses. And there are also combination spot-ons containing imidacloprid and moxidectin that can be used maybe once or twice according to the label.
So lots of options for the vet to choose from, depending on the cat and the situation.
Exactly. They'll pick the best approach based on the cat's health, the severity, owner preference, and things like ease of application. And they calculate those doses very carefully. You shouldn't just guess or use dog products.
Absolutely. Vet guidance is key. Now, how do you stop it from coming back? Prevention seems tricky if it's about contact.
It is tricky. Reinfestation is always a risk if the cat comes into contact again with an infected animal.
Yeah.
So if you can figure out where the cat got it from, maybe a neighborhood cat or a new cat introduced, that helps.
Finding the source.
Yeah. And again, the most critical prevention step in a multi-cat household, or if you know the source, is treating all the potentially exposed cats. Break that cycle completely.
Right. Treat everyone. What happens if treatment isn't done quite right? What are the potential problems?
Well, like we said, if topical treatments like dips aren't applied everywhere, especially the face and ears, it's likely to fail. The mites just survive in the untreated areas.
Okay.
And, of course, the biggest reason for failure or recurrence is not treating all the in-contact animals. You clear it up in one cat, but another one is still shedding mites, and boom, it comes right
It's a
back.
frustrating cycle.
Very. And delaying treatment or having failed treatments just means prolonged itching, more skin damage, and a higher chance of those nasty secondary infections taking hold.
So being thorough is really paramount. What's the typical outlook once proper treatment starts? How quickly do things get better?
If you treat everyone involved correctly, the response is usually pretty fast. You should see a definite improvement in the itching and the skin lesions within about 2 weeks, maybe even sooner.
That's good news. Do cats become immune after they've had it?
Unfortunately, no. They don't develop lasting immunity.
Mhm.
So a cat that's been successfully treated can absolutely get Notoedric mange again if they're re-exposed later on.
Oh, okay.
And interestingly, if a cat does get reinfected, the signs might actually show up faster the second time around, possibly because their immune system is already primed, sensitized from the first infection.
Faster onset.
Yeah.
Okay, good to know. All right, let's try and wrap this up. What are the absolute key takeaways people should remember about Notoedric mange?
I think the main things are, it's caused by a specific mite, Notoedres cati. It's highly contagious between cats through direct contact. The defining sign is intense, non-seasonal itching, often starting in the ears and head.
Right.
Diagnosis is usually confirmed with skin scrapings. And successful treatment hinges on using an effective medication, treating the entire cat, and this is crucial, treating all in-contact cats at the same time.
Treat everyone, treat thoroughly.
Exactly.
Yeah.
And maybe just remember that little detail that even humans can get temporarily icky from it too.
Yeah, that's definitely a memorable point. It really drives home the connection. So thinking about that, how easily it spreads, how it can jump, even temporarily to us, what larger thoughts does this spark for you about, animal health and our connection to it?
That's a great question to ponder. It really highlights that animal health isn't just this isolated thing, right? It's interconnected. Zoonotic potential, even if minor, like this transient itching, reminds us we share environments and sometimes pathogens. It underscores why vigilance with our pets' health matters for them, for other animals, and sometimes even for us. It makes you think, what other conditions that seem specific to one species might have broader ecological or health implications that maybe we don't fully appreciate yet? It's that whole One Health concept in action, isn't it?
It really is. Food for thought. Thanks for breaking all that down for us.
My pleasure.